For anyone preparing himself for newborn life support, NLS course, please listen to this before the course. I will summarize the whole course, whole steps and stages. Go to the course and practice the clinical part to pass successfully. I will go directly to the scenario. First, you will receive call from obstetrician. He will tell you, I have one lady presented in ER with bleeding, and I will send this lady for emergency section. Please attend the delivery. So what you will do, first action, you will ask him for question. Actually, not 4 questions, 3 questions and 1 request. But imagine it is 4 questions because we'll use number 4 many times. Always remember 4. First thing you will ask this lady, pregnant in term or preterm. Second, if any risk factor like multiple pregnancy, means single or multiple. Any risk factor, she has chorioamnitis, she has gestational diabetes mellitus, she has hypertension, any risk factor. Third question, what is the character of amniotic fluid? Then the 4th question, but actually not question, what is the plan? What is your plan for umbilical cord? It means you will tell the obstetrician what is your plan. Tell him if the baby delivered in good condition, means delivered vigorous, please delay the cord clamping for 60 seconds. So again, the first 4 questions, you will ask the obstetrician. You are pediatrician. You will ask the obstetrician the 4 questions. Term or preterm, what is the gestational age? Second, any risk factor. Third, amniotic fluid character. And the 4th, which is not question but request, tell him please delay the cord clamping for 60 seconds if baby delivered in good condition. Then tell him thank you and go to do what? You will do 2 important points. First, you will call your team to help you in resuscitation. Second, go and counsel the mother. If the condition allow to counsel her, tell her what you will do, who are you, and what expected to do with her baby. So with your team, what you will do 2 points. Remember 2 with your team. This is briefing. Well, initially, before the delivery, you will do briefing. Then at the end of scenario, at the end of resuscitation, you will do debriefing. Now, you will call your team, counsel the mother. Your team come and do 2 very important points. Summarize the history you received from obstetrician and distribute the task. Assign the task with your team. See how many members your team? 3, 4, 5, and assign. Assign the task. First one to do initial step. You will receive the baby and do initial step. Second one, you will do respiratory support. Third one, you will do cardiac massage. 4th one, you will do medication. You will give medication and documentation. Then go with your team and prepare the equipment. Which equipment you need to prepare, it depends on the stages. I mean, you have 5 stages expected to resuscitate the baby. First stage, the initial step. Second, you will give 5 inflation breaths by mask. Third, you will give 5 inflation breaths by 2-person technique. And third, you will do 5 inflation breaths but by alternative airway, LMA. Then you will do cardiac massage. Then the last stage, you will give medication. So this is actually 6 stages in resuscitation of any newborn. Assign the team according to this and prepare your equipment according to this. Check, imagine which equipment you need in each stage and prepare the equipment according. The most important point to prepare the equipment is the respiratory. Check the mask, check LMA, check the self-inflating bag, check the pressure. Pressure in resuscitator. How much pressure you will give? Set the pressure according to the gestational age you received from the obstetrician. He told you it is this lady is term, pregnant in term or preterm. Pressure is 30/5 in term, 25/5 in preterm. and set the FiO2. FiO2 in term 21 room air, and in preterm 21 to 30. In extreme preterm, if you have extreme preterm less than 28 weeks, it will be 30%. Now you set the pressure, you set FiO2, warmer on, open the warmer. Why? Because you need 2 pre-warmed towels, and these towels need some time. So once you receive first call from obstetrician and you call your team, you counsel the mother and you prepare your equipment. During the preparation of equipment, warmer on, but timer on with delivery of this baby. Now we are in preparation, warmer on. Then wait for the second call. Second call from obstetrician. You will go to operation theater or labor room and wait to deliver. Once baby deliver, this is the second call. The obstetrician will call you baby delivered. So you will ask him again. Second, 4 question. You will ask about he is breathing or not. How is the heart rate? What is the heart rate? Second, what is the tone and what is the color? This is the second 4 question. But start with breathing and the heart rate, which is more important. If this baby is vigorous, heart rate more than 100, and he is breathing, and the tone, good tone, and the color is pink or red, so this means this baby is vigorous. So tell the obstetrician, please delay the cord for 60 seconds. Now we will go to first stage of resuscitation. You will take the baby from the obstetrician after 30 second delayed cord, and you will go and do initial steps. Initial steps, what you will do, you will receive the baby by pre-warmed towel and the timer already on once baby delivered, and put in resuscitator, dry, stimulate, remove the wet linen, and use the second pre-warmed towel, and do dryness stimulation, and head cap is very important. Head cap. And if this baby preterm, use plastic bag and don't dry. This is if this baby less than 32 weeks. So after this initial step, don't forget last important step, which is put the baby in midline position, not a sniffing position. We are not using the sniffing position now, because the sniffing position means little hyperextension. But now we are using midline, neutral position. So put the baby in neutral position and check third 4 question. First 4 question with first call, second 4 question once baby delivered, third 4 question after initial steps. How is the breathing? Baby is breathing or not? How is the heart rate and tone, color? If fine, baby breathing well, regular breathing, and the heart rate more than 100, and good tone, color pink, so nothing more, you will take this baby to the mother to do skin to skin and counsel the mother. Counsel means tell her what happened. Tell her your baby delivered in good condition, crying. We did only initial steps, dryness and stimulation, and now you can do skin to skin if the mother condition allow. Then don't forget, go to your team and do debriefing. Debriefing 2 points. Don't forget 2 points in debriefing. Summarize the scenario, what happened, and listen to your team. Take feedback. Take feedback from your team. What happened in good, what happened need to be corrected. If baby after initial steps breathing, he's not breathing, heart rate low, less than 100, and tone, color not good, so means what you will do, I will give the baby 5 inflation breaths to open the lung, 5 inflation breaths, and you have to mention like that in the course. I will give 5 inflation breaths, each breathe 2 to 3 seconds. How to give? This is the rhythm. 1, 1, 1, release. Release, not breathe. 1, 1, 1, release. 2, 2, 2, release. 3, 3, 3, release. Okay? Up to 5. Then ask again the 4 questions, but actually concentrate in 2, which are chest is moving or not. please remember, here we will not ask breathing or not. We will ask here after any 5 inflation breaths, we will ask about chest is moving or not, chest is rising or not. What does mean? You are checking if this 5 inflation breaths open the lung or not, successful to open the lung or not. So ask about chest is rising or not, heart rate, how is the heart rate, is increasing or not. Now we are not asking about what is the heart rate, we need to see the trend, the effect of this 5 inflation breaths on the heart. It is the heart rate is increasing, it was 70, then now 100, then 120, so it is increasing or not. And the most important in these two questions is the heart response to the heart to these 5 inflation breaths, better than chest is rising or not. But ask about 2 points, chest is rising or not, and heart rate is increasing or not. And if you need to memorize this 4, you can add tone and color. You can ask about chest is rising or not, heart rate is increasing or not, tone, color, to be 4. Yeah. Okay, so if responded, good. Chest is rising, heart rate is increasing. So what you will do, I will give 15 ventilation breaths. Now I succeeded to open the lung. So what I will do after opening the lung, I will continue ventilation. So first inflate, then ventilate. So 15 ventilation breaths over 30 seconds, each breathe 2 seconds. You have to mention like this. What is the rhythm is breathe 1, breathe 2, breathe, not release. Breathe. Now breathe 1, breathe 2, breathe 3, up to 15. Then ask about what? Don't ask chest is rising because already chest rising from the 5 inflation breaths. Now you will ask baby is breathing or not, heart rate, what is the heart rate, and tone color. So now you can check the breathing, not chest rising. After ventilation, check for breathing, not chest is moving or not. If fine, baby is breathing and the heart rate is good, more than 100. So what you will do, you will wean gradually. You will wean what? You will wean ventilation. How to wean the ventilation? After any ventilation, how to wean? Ventilation is breathe 1, breathe 2, breathe 3. How to wean? Breathe 1, breathe 1, 2, breathe 1, 2, 3, breathe 1, 2, 3, 4. This means you are gradually weaning the respiratory support. After that, if baby is breathing well, heart rate is okay, tone, color is okay, saturation is okay, what you will do, you will send the baby to post-resuscitation care. You will not send the mother because this patient receive resuscitation. So with mild resuscitation, you will send him to post-resuscitation care. But if aggressive resuscitation, you will send him to NICU. After sending the baby to post-resuscitation care, what you will do, you will go and counsel the mother and do debriefing with your team. Debriefing means 2 points. Summarize what happened during this resuscitation and listen from your team. Take background from your team. What happened in good, what happened need to be corrected in next scenario. Now the third stage, if you give 5 inflation breaths and chest is not rising, heart rate is not improving, what you will do, you will do 5 inflation breaths by 2-person technique. One will fix the mask and one will give 5 inflation breaths. 2-person technique. What you will do, I will give 5 inflation breaths, 2-3 seconds each breath by 2-person technique. After 5 inflation breaths by 2-person technique, I will ask again, chest is moving or not, because I am giving inflation. So with inflation again, you have to ask chest is rising or not. Then how is the heart rate? Is improving or not? If responded, fine. Chest is rising, heart rate is improving. So go and give 15 ventilation breaths. And if evaluate after 15 ventilation breaths, what you will evaluate, baby is breathing or not. Heart rate. What is the heart rate? Should be more than 100 to be normal. If it is okay, wean gradually, send it to post-resuscitation care, go to the mother and the counsel, go to your team and do debriefing by summarize the scenario and listen feedback from your team. If you give 5 inflation breaths by 2-person technique and chest is not rising, heart rate is not improving, what you will do, I will go to 4th stage, which is I will use alternative airway to give 5 inflation breaths. Alternative airway, either LMA, laryngeal mask, or intubation if you have a skilled person. But during the course, always we are concentrating on LMA because any medical staff, physician, nurses, RT, whatever, can use this LMA. So now after 5 inflation breaths by 2-person technique, it is not working to open the lung, I will go and give 5 inflation breaths by alternative airway. How to insert the LMA, this is, I will leave in practical, you will insert by laryngoscope and you will push the LMA till feel resistance. Then deflate first, then inflate by 2 ml air and check with CO2 detector, should be change the color to yellow. Then give 5 inflation breaths by alternative airway LMA. Then evaluate what? Evaluate chest is rising or not, chest is moving or not, heart rate is improving or not. If heart rate is improving, chest is rising, give 15 ventilation breaths, 2 seconds each breath over 30 seconds. Then evaluate after that by breathing or not chest rising, breathing or not, and what is the heart rate. We forget to mention in initial steps, please connect pulse oximeter and connect temperature electrode. So after 15 ventilation breaths, breathing or not, how is the heart rate? Then baby is breathing and the heart rate is improving. So wean the ventilation gradually, like breathe 1. So you will say breathe 1, breathe 1, 2, breathe 1, 2, 3, okay, up to 5. So then send the baby to post-resuscitation care and go to the mother council and go to your team to do the briefing, summarize the scenario and take feedback from your team. Now we will go to 5th stage of resuscitation. If you have heart rate less than 100, what you will do? If from 60 to 100, you will continue with ventilation. Don't stop ventilation till heart rate more than 100. Second scenario, if heart rate less than 60, means you have to do chest compression. How to do chest compression? You have 2 techniques. Technique is 2-finger technique and 2-thumb technique. 2-thumb technique, usually we are using this technique, but 2-finger technique if you are alone and you have nobody to help you. So you can do chest compression by one hand and do ventilation by the second hand. But usually we are using the 2-thumb technique, 2 hands. So you have to mention location of the chest compression and the depth of chest compression and the frequency of chest compression. Frequency, it will be 3 to 1. 3 to 1, 3 chest compression, 1 ventilation. Depth, 1/3 of the chest. And the location, you will put 2 thumb below the nipple line, above the sternum, and you will do compression of the chest around 1/3 of the depth. Then 3, 2, 1 ventilation. 1 and 2 and 3 and breathe. 1 and 2 and 3 and breathe. And don't move away your thumb from the skin. Keep on the skin. Don't leave the skin. 1 and 2 and 3 and breathe. 1 and 2 and 3 and breathe. Then, first important point, once you decide to give chest compression, you have to do 4 actions. remember, very important, very essential. If heart rate less than 60, do 4 things. Call for help because you need more help, because you will do aggressive resuscitation. Call for help, increase FiO2 to 100. Third, connect ECG electrode. And the fourth one, you can increase the pressure, because initially you are using pressure 30/5 in term and 25/5 in preterm. So now you can increase more. You can give term 35/5 and you can give preterm 30/5. Okay? And if this patient not intubated and you have a skilled person to intubate, you can intubate. This is the four actions you have to do once you decide chest compression, before chest compression. Call for help, ECG, electrodes, FiO2 100, and increase the pressure, or intubate if you have a skilled person. Then do chest compression as we said. Then evaluate by 4 questions. What is the 4 question? Breathing or not? What is the heart rate? How many minutes now? And the age of the baby, how many minutes? And the saturation. To check the target saturation, you have a small paper to tell you what is the target saturation. It is 3 steps. You will see this in a clinical. After this evaluation, if baby is breathing and the heart rate is good, means heart rate between 60, now increase after chest compression, between 60 and 100, continue ventilation to see the heart rate more than 100. If already heart rate more than 100 and baby started breathing, if regular breathing, effective breathing, wean ventilation gradually. If not, still not effective, continue ventilation. So you will continue ventilation, 15 ventilation breathes over 30 seconds, 2 seconds each, if not effective breathing. If there is effective breathing, wean gradually the ventilation and send the baby to NICU. Then go and counsel the mother, tell her what happened, and go to your team and do debriefing. Now you will go to last step, which is medication. So if you did chest compression with ventilation 3-1 and you asked about 4 points, breathing or not, heart rate, age, and saturation. So patient is not breathing, heart rate is still low, less than 60. Now you have to give medication. You have to know what is the medication, what is the dilution of each medicine, and what is the dose, and how many how many doses you will give. Okay, first important medicine is adrenaline. Adrenaline dilution is 1 to 10,000. Dose is 0.2 ml per kg from this dilution. How many doses? 3 doses. And you have option to give first dose by endotracheal tube. Only 1 dose. How to give this endotracheal? The dose is 1 ml per kg. What is the route? IV. Only IV through umbilical vein. Once you decided to do chest compression, ask one from your team to insert UVC. How to insert? You will insert 5 centimeter and check with good backflow. So what is the route to give medication? I will give through UVC. If you have no UVC, no place for IV line, no peripheral IV line in resuscitation. What you will do? I will do intraosseous. Intraosseous to give any medication, even fluid, glucose, whatever the medicine you can use. Intraosseous line like UVC. First one. Then continue chest compression with ventilation for 30 seconds and evaluate. What is the duration between each dose of adrenaline? 3 to 5 minutes. What you will give during this duration, I can give another medicine. I can give normal saline. Second medicine is normal saline. What is the dose? Dose is 10 ml per kg. Concentration in 0.9%. Normal saline. How many doses you can give? I can give also 3 doses, but alternatively. Then third drug is glucose. What is the dose of glucose? What is the concentration? Glucose is 2.5 ml per kg. Concentration is 10%. Dextrose 10%. Then last medicine, which is not usually we are using now, is the sodium bicarb. Sodium bicarb is removed now from modern resuscitation of NLS course. But to remember these 4 medicine. You will give the adrenaline and you will continue. then you will give continue chest compression with ventilation, and you will give normal saline and continue chest compression with ventilation for 30 seconds. Then evaluate, always evaluate after any action, evaluate by this 4 questions. What is 4 questions? Breathing, heart rate, age, saturation. And repeat the adrenaline dose till every 3 to 5 minutes. Total time of resuscitation is 20 minutes. After this 20 minutes, after all steps of resuscitation, after 3 doses of adrenaline and normal saline and glucose, and no response, heart rate is low, you will stop resuscitation. After any step of resuscitation, after good response, so send the baby for NICU to continue management, and go to the mother and counsel her, and meet your team, do 2 points, summarize the scenario, and listen for background of your team. This is in brief the Newborn Life Support Course, NLS. Listen to this before the course, and go to the course, practice these steps and stages. Send this summary of NLS to any one of your colleagues preparing himself to newborn life support, to help him to pass the course. And I hope you pass the course. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.